tomorrow from this nightmare. Will I lose?
Hello, my name is Justin B. Smith, and I'm originally from Silver Spring, Maryland. I'm 28 years old, African American, gay man, and I'm HIV positive.
Will I wake from this nightmare? Will I lose?
My name is Mick Mason, I'm 41 years old, I am a haemophiliac, and due to my haemophilia I've been infected through blood products with HIV, hepatitis B and hepatitis C, and have been for the last 25 years.
This nightmare, will I lose my dignity? Will I lose my dignity?
This is not something that, if I get HIV I can just take a couple pills and I'll be fine. This is something that you have to do for the rest of your life.
I grew up in western Pennsylvania and moved to Columbus, Ohio after graduating from college with the intention of getting some good clinical experience. I started out at OSU hospitals in infectious disease. I've been a nurse for 28 years.
My full name is Tanya Motley. I grew up in Columbus, Ohio, born and raised in Columbus, Ohio. I got in the field of HIV prevention education work through my brother Earlington. I have been a Columbus AIDS Task Force employee for 14 years. I got in the business in 1997 and to the present. I am presently the African American HIV prevention coordinator.
I was actually one of the first nurses involved with HIV care here in Central Ohio. Back in 1983 when I started in infectious diseases, I took care of the first AIDS patient that OSU had as an inpatient. I was also then the primary nurse for the second patient we had, and he was a young father of 4, and he was a hemophiliac, who now we know who got it through his blood transfusions. Back in the early 80s, really, I think before HIV reared its ugly head, our society was not used to hearing about gay-related issues, men having sex with men, injection drug use. It's existed for eons, but no one really talked about it.
Before you got involved in your current career, did you know anybody with HIV disease?
Yes, I did. My brother. My brother was infected with HIV probably back in 1983. In the community of color, we really weren't talking about HIV. To us, HIV was in the white community, it was in the gay white community, or the homosexual community, as they were calling it back then. So my education was very limited. He was my best friend. I didn't know I was his caretaker. I thought my biggest issue was he's going to die and I don't want to lose my brother.
When it first really reared its head, it was in the way society viewed it was, it was people that were doing things they shouldn't be doing anyways. Or that's what they get for having sex with men. That's what they get for doing drugs. The need for education was so necessary. We would have food service staff place trays of food on the floor in a hospital outside their room because they were afraid to go in because they would get it.
When I was a teenager and we talked about health in school, it was more about don't have sex, get married first. But growing up in a household with a brother that was infected when I was a teenager, it didn't hit me. It didn't matter to me. It wasn't a situation for me because I put it all on. He was a gay black man. I thought gay was just being happy. I didn't know what two men would want to do with one another.
When you're looking at the mid-'80s to late 90s, you're still talking about closed-minded America. Other countries like Europe, they openly talk about sexuality. They have condom billboards. So their numbers stayed low, much lower than ours, because their society, it's okay to talk about sexuality, sex, drugs, rock and roll, the whole bit, whatever. And this country is much more conservative. That is what hurt this country, is our country, and the conservatism that it has really manifested a lot of public health issues, not just HIV/AIDS.
I would say back in the early 90s when Magic Johnson came out with his status to the entire world, I think the black community was shocked. It was disbelief that a basketball player at that high magnitude, making that money, had a wife, had a family, could put himself at risk for HIV and didn't know who gave it to him. But I think the key for the community was a wake-up call. Now, when we look at 30 years of this epidemic, we're communicating more. We have more marketing strategies out there. ASOs are hiring folks of color to talk to folks of color. Not that folks that are not of color cannot. It's just, if you look like me and you're in my community, I'm going to listen to you further than someone that is not of color.
We had a lot of resistance back then because it wasn't my disease. It's not in my community. It's not in my town, not on my street. Therefore, oh well. In the beginning, education and prevention, people shut us out. If they could not relate to being a gay man or a white man, cultural groups would shut us out. People that didn't think they were at risk would shut us out. So it was very difficult to get the education information out there. By the early 90s, once we lost a lot of people from HIV/AIDS, then people started paying attention. Early on, I took care of an 18-year-old who was gay, but he was only 18, so he'd only had one sex partner. And unfortunately, he contracted HIV, which within months turned into AIDS, and he died in my arms. And I remember that day like it was yesterday. And that to me was like, this is awful, because his parents abandoned him, his church abandoned him, his friends abandoned him, and here was this precious little 18-year-old. People should not die alone no matter how old they are. They shouldn't be abandoned because he chose a sex partner that other people didn't agree with.
Watching going through the phases of Ryan White, a lot of young people do not know the sacrifice this young man and the stigma and the discrimination that this young man and his family had to go through. And he is not the only family that dealt with that.
In 1990, the Ryan White Care Act was a congressional act to develop a system of services to help care for people with HIV and AIDS. Ryan White was a young boy who was a hemophiliac who got HIV/AIDS through his factor VIII. And the trauma and the emotional havoc that he and his family surpassed resulted in this wonderful act that really helped pump up awareness in this country. Here's a little white boy who's infected. Here's what his life has been like. How can we help? So it wasn't until then that the government even really did much about it.
Tell me a little bit about the quilt.
The quilt. The quilt was started up in the 80s and late 80s, and what they did as part of like therapy is make a patch quilt in remembrance of somebody you loved and lost because of HIV disease.
You put your arms around me and I'm home. You put your arms around me and I'm home.
The quilt actually ended up going from city to city to city. And those of us that were involved in HIV care and prevention walked around and helped display the quilt, and we helped comfort those that came. And it was a very emotional process because it brought up a lot of memories, a lot of suffering, unfortunately.
And clear, just a chance that maybe we'll find better days. 'Cause I don't need boxes wrapped in strings and designer love and empty things. Just just a chance that maybe we'll find better days. So take these words and sing out loud, 'cause everyone is forgiven now, 'cause tonight's the night the world begins again.
I was there to help comfort parents and people that came to see the quilt. And, you know, I ended up needing comfort myself because those were my patients. You know, almost everybody that died in the 80s in Columbus, Ohio, I knew personally, and they were my patients. And so that was very hard.
And the one poor child who saved this world.
After I was at OSU, I was hired by the feds to finish writing a federal waiver to help care for AIDS patients in their homes. 1985, the Columbus AIDS Task was founded. So I was part of that process, which was really interesting because there was nothing in the community to help people with HIV/AIDS. And so this Grassroots, a couple men, Debbie and I, we just started it. We started a speakers bureau. And so we gradually helped them get off the ground and running, and Columbus AIDS Task Force is still in an organization today, and it was one of the first AIDS organization in the country.
Resistance is futile, Arlington would say. It's killing us and we need to address it as a community. And I think small steps is better than anything. And I think that's where the change is. But a major change is HIV testing by the CDC.
It really challenged America on many, many different levels. Probably emotionally, socially, religiously, culturally were the biggest ones. HIV/AIDS and what it did to this country really transformed history. And it transformed history into the future. And the level of understanding and acceptance for people with differences, I think, really grew from this. But there were many years of turbulence. Anything that's sexually transmitted, anyone's fair game. You know, HIV is a virus. It doesn't discriminate color, wealth, how you know, who you have sex with or how you do it does not matter. What happened was it forced Americans to look into every aspect of their being. We had churches kicking out members that were HIV positive, and then kicking out members that were just gay. We had social and class issues. You know, it's among the poor. It challenged healthcare because here were people that were desperately ill, in need of medications and all kinds of care need, and there wasn't the resources and there wasn't the motivation to get the resources. We had educational challenges. How do we reach out to people to educate them on how to protect yourself? There was a huge financial impact to this country because, unfortunately, because we didn't have good home care back then to care for these critically ill folks, they would stay in the hospital for sometimes 4, 5, 6 months at a time to be cared for, because there either wasn't home care agencies that would serve them because of the fear of the disease, or we didn't have the resources to meet all their needs.
Seasons of love.
If Arlington was sitting across from me and hearing me have this conversation with you today, which I'm very honored to do that, and I truly thank you so much for it, he would say this community, or all of our communities, need to heal. HEAL stands for health, education, advocacy, and love. And that's what I would like to give to the community and all of our communities, to know your status and heal.
The more we educate, the less disease.
So I think we need huge better education and peer education in schools.
I'm 28 years old. I have a lot more years ahead of me.
Sing out, though the story never